Hi everyone, my name is Dr. Rishma Om Lakhani. I am a consultant gynecologist at DocOnline India Health Private Limited. Today we are going to speak about postpartum depression, signs and symptoms, and how do we manage it. So what is postpartum depression or a postnatal depression as it is called? Usually it is a serious disorder which occurs after childbirth. Lack of interest in the baby, persistent spells of sadness, guilt, hopelessness marks postpartum depression. It usually occurs between 1 week to 1 month after delivery but can occur anytime up to 1 year. Right? Persistent thoughts of hurting yourself or hurting the baby is a concern and marks medical attention. Right? What are the types of postpartum depression? Postpartum blues or postpartum depression and postpartum psychosis are the three main types depending upon the severity. Baby blues are the most milder form in which a patient has frequent crying spells, sadness, there is loss of appetite. It usually goes away within few days to 1 week's time. Postpartum depression is a moderate form in which patients can have mild to severe symptoms of depression and needs treatment. Postpartum psychosis is the most serious form in which patient may have confusion, agitation, irritation, and suicidal thoughts. So, what are the causes of postpartum depression and who are at risk of having it? Childbirth is a life-changing event and can be overwhelming for the person as well as for the family members. It brings about physical, mental, emotional, social, and financial changes. A sudden drop in the estrogen and the progesterone level could be a trigger for postpartum depression. The risk factors may include a previous history of postpartum depression, previous psychological illness, a bipolar disorder, drug history or alcoholism, smoking, a complicated pregnancy or a complicated childbirth could be a few of the risk factors for postpartum depression. Now let us look at the signs and the symptoms. As I previously said, persistent feeling of sadness, loneliness, guilt, emptiness, irritation, lack of taking care of the baby, lack of personal hygiene, suicidal thoughts, either excessive sleeping or lack of sleep, irrational fears. Any of these 5 symptoms present for persistently 2 weeks marks postpartum depression. Bisexual mothers, surrogates, as well as males could be affected by postpartum depression because of sudden drop in the estrogen, progesterone, testosterone, and prolactin levels. Right? This leads to decreased infant bonding. So how do we manage these? Right? Management depends upon the signs and symptoms and the severity of postpartum depression. Right? It includes medication, psychotherapy, as well as support from family and friends. So if you are experiencing any of these symptoms, do not panic, you are not alone. Nearly 15% of women suffer from postpartum depression. So reach out for help, take good food, take proper rest, and talk to your friends if you are experiencing any blues after delivery. And for any medical assistance, you can reach out for the doctors at DocOnline anytime. Thank you and have a great day.